I want to talk briefly about the Sierra trial. Sierra trial is a study of Iomab-B in elderly patients with relapsed or refractory acute myeloid leukemia. Just as a background about this, when this study took literally two of the patients, the highest risk patients that are elderly patients over the age of 55, and patients who have either relapsed or refractory disease. And actually the inclusion in the study were you have to be over the age of 55, you needed to have already clear donor, and your disease had to be primary refractory or relapsed within 6 months of achieving complete remission, or a group of patients who had relapsed disease and were not going into a complete remission. And any patients beyond the second complete remissions were also included in this study. Since all of them had a donor ready for transplant, patients were randomized either to conventional care or transplant using Iomab-B. Conventional care patients got chemotherapy based on investigator's choice, and if achieved complete remission, they were transplanted as we would do in real life. For the patients whom the investigators felt were not candidates for transplant, they could continue to get maintenance chemotherapy per the choice of the investigator. Patients in the Iomab-B got a stem cell transplant, receiving Iomab-B approximately 2 weeks before a reduced intensity conditioning. The primary endpoint of the study was duration of complete remission lasting more than 6 months. So essentially the patients in the two arms who achieved a complete remission wanted to see how long did the remission last. Patients could also cross over from the conventional care arm to the study arm if they did not go into remission between days 14 and 28 and still qualified for the study, and that group was also analyzed separately. The study has been going on for 6 years, and there were several interim analyses speaking to the safety of the product, which I'll probably not go in details today, but the final results were shown in this meeting. The study met its primary endpoint. The duration of remission of both the duration of remission of more than 6 months and 1 year survival. In fact, the median survival in the treatment arm was double as compared to the standard of care arm, and 1 year survival was also double, 26% in the study arm versus 13% in the standard of care arm, indicating that this was a positive study. So this study also currently changes the paradigm of how we treat patients with refractory disease. Initially, we, the transplanters, believe that it's important for the patients to be in remission when we take them to transplant. This is one of the two studies within the last 6 months, one at ASH and one, and obviously the Sierra study, which is changing or certainly challenging the paradigm whether the patients really have to be in remission. And the other study I was referring to was the ASAP study which was a plenary study at the American Society of Hematology meeting.